What to do if the grand test scores are not improving? This is one of the commonest question that students ask me. Let me try to answer this question. And I am Dr. Praveen Tripathi. I am a faculty of Psychiatry. And students, before I answer that, I want you to remember a couple of things. What is the primary reason for taking grand test? And what is the secondary reason for taking grand test? The primary reason is that you have to get used to that 3 hours sitting on a stretch. You need to kind of train your mind and your body to that rigor of 3 hours continuous sitting and attempting the paper. That is the primary motto of taking grand test. The secondary reason is, or the secondary motto is, you get to check the levels of your preparation. It is not the other way around. Many students think that it is the other way around. No, that is not true. Also, please remember students that the performance on grand test is not linearly correlated with the performance in the real exams. Reason being, grand tests are usually tougher than the actual exam. Now see, whenever any institute makes grand tests, it tries not to repeat questions, it tries to create a good mix of difficult questions with moderately difficult questions and simpler questions. Now this whole scheme is slightly different than the real exam. In the real exam, the number of repeat questions are usually more, and the proportion of simple question and the moderately difficult question is also more in comparison to the GTs, and that is applicable to the GTs given by prepared by all the institutes, irrespective of what institute GT are you appearing for. This is something that is applicable to everyone. So there is no need to get so disheartened if you don't get as good a score on the grand test, and please do not start assuming that if you are not scoring that well on grand test, you would not score as good in the real exam. More importantly, rather than looking at the score of grand test, you should be more concerned with the percentile. At the end of the day, it's an entrance examination. You have to be better than others to get selected. So if a particular grand test is so difficult that everybody is performing poorly, in that case, even if you get not that good a score, it's fine. But your percentile should be good. But again, remember that all these things you should keep in mind. But the crux of the matter is, even if you are not preparing, even if you are not performing as good on a grand test, it does not mean in any way that you would not be able to perform well in the real exam. That said, we should at least analyze what is going wrong. If you are stuck on a particular score, or if you are not able to improve your percentile in the grand test, you should do a bit of investigation. Where are you going wrong? Now what we see is that students tend to make one of the 3 mistakes. The first type of student who is not getting as good a result is the one who struggles with the time. Either they are not able to complete the questions in the given duration, or even if they are able to complete it, they are short of time, and that is why when the long questions come, when the clinical vignettes are asked, they start making silly mistakes. They get anxious because the clock is ticking, and they start making silly mistakes, and in the end the performance suffers. Now if you are one of these students, if you are one of the students who struggle with the time, the way out for you is to take as many tests as possible. As you start taking more tests, you start understanding what suits you the best. For some students, the better way is do those questions first that you are very sure about, and in the second round try doing questions which about which you are not so sure. For other students, it does not work that well this way. They like going from question number 1 to the question number last in a flow. When you take multiple tests, you start realizing what works better for you. So if you are a student who falls in the first category, this solution works better for you. The second category of students, what happens with them is they are weak in a particular subject. They might be weak in pharmacology, they might be weak in pathology, they might be weak in surgery. For these students, of course, the best way is to strengthen that particular subject. Now students, we have to take different approaches at different times. Ideally, at this time, like 3 months before the examination, if you are talking about NEET, it is not good to start any subject from the beginning, and it is not good that you go through the entire video of a particular subject. But if you are consistently underperforming in a particular subject, it might not be the worst idea to at least prepare that subject again, right? It entirely depends upon the situation. Say if you are underperforming every time in pharmacology, or say if you are underperforming every time in biochemistry or psychiatry for that matter, it would be good that if you go through those videos, whatever the duration is, and strengthen that subject. That way you would not get dragged down again and again by a particular subject. But you have to keep this or take this decision after taking into account everything else. By everything else I mean the preparation levels of all other subjects. This approach is only useful if you are dragging, if you are underperforming in one or two subjects. Now, third type of students tend to underperform because they tend to make more mistakes in the factual questions. Although thankfully the number of factual questions that are being asked in the exams, it's going down. Now the examination is becoming more conceptual, it is becoming more clinically oriented, but still they still do ask such questions. If you are making mistakes on facts, then you'll have to go back to the time tested techniques of using memory cards. Make certain papers and write down all those facts, and just paste those papers on the walls of your room. Put 8 or 9 papers, and every day give 5 minutes or 7 minutes and just look at those papers. If you are making again repetitive mistakes on facts, this ensures that those things are fresh in your mind and you don't make those mistakes, right? So you can do all these things. Another thing that you must remember is that students, the improvement in the grand test scores is not linear, right? It tends to improve exponentially towards the fag end of your preparation. Reason being, as you keep on revising the subjects, as the information keeps on getting more fresh in your mind, you are able to answer more questions correctly. So you might see this pattern that in the initial 6 month or 7 month, your improvement in the grand test is very slow. It increases by bits and pieces. But towards the end, in the last few weeks, in the last few months, you might see a sudden spurt in your scores, and this happens because more and more subjects gets revised. So do not get disheartened, right? As I repeatedly say that in entrance examination, half the battle is won if you can take your preparation to the last day. And I would say that at least 30 or 40% students give up in the process. Either they stop studying, or they stop studying with that intensity. They stop competing. They kind of accept that it is not possible, so they don't give their best. So don't be in those 30-40% population. Please try to be in the population which is taking the better to the last day. And last point would be that even after doing all these things, grand tests make you very anxious. If you end up wasting many days after giving grand test because you get disappointed, if you are such a student, in that case probably you can go with the subject wise test rather than giving grand test and wasting time. Prepare a subject, give a subject wise test, and in the end, in the last month, you might take a grand test or two just to have a feel of the real exam. This approach also works for many students. I have seen so many students who never appeared for a single examination in the entire preparation period. They just went off and gave the final exam and got selected. So different things work for different people. Just because everybody is doing one thing, you don't have to follow it. You might be a person for whom another approach might work. So basically the crux of the matter, what I want to in the summary, what I want to say is, every person is different. You may not be so good in taking these tests, but you may end up doing very well in the final examination, and you have to ensure that you do not do anything which makes you so anxious that you are not able to even study. So keep these things in mind, continue studying and take your preparation to the last day. Best wishes, God bless you.